Hi, I am Niveta. Now I am going to present a topic of radiation shielding in hospitals. Then, for the introduction, ionizing radiation is used to in medical imaging and treatments, posing risks to patients and staffs and the public. Effective shielding is crucial to minimize exposure. There are two types of radiations: ionizing radiation and non-ionizing radiation. Ionizing radiation has X-rays, gamma rays, alpha, beta and neutron radiation. The non-ionizing radiations are UV rays, visible lights and radio waves. Then the radiation shielding principles are time, minimize time exposure. Then the distance is increased distance from the source. Shielding should be uses the materials of absorbing radiations. Then the shielding materials are lead. Lead is commonly for X-rays and gamma rays. Then the concrete are effective for X-rays, gamma rays and neurons. Water is the neuron shielding. Boron for neuron capture. Then the design considerations. Facility layout. Shielding requirements depend on equipment type and location. The occupancy is the shield for areas with frequent occupancy. Workload. Consider equipment usage. Then the regulatory frameworks are follow guidelines from NCRP and ICRP and local authorities. Dose limitages are 20 to 50 mSv per year for occupational exposure. Shielding calculations should be like determine the required thickness based on radiation type, energy and distance. Then use formulas or consult experts. Diagnostic imaging shielding are X-ray rooms, lead lined walls and doors and windows. CT scanners lead or concrete shielding. Then the radiation therapy shieldings are linear accelerator and brachytherapy. The linear accelerator is thick concrete walls that's like 1 to 2 meters. Then the brachytherapy is lead shields and containers. Then the nuclear medicine shieldings are syringe shields, lead lined storage and also then the linear accelerators are thick concrete walls 1 to 2 meters. The brachytherapy is lead to shields in containers. The nuclear medicine shieldings are syringe shields, lead lined storage and waste containers. The patient shielding is post-treatment. Then the personal protective equipment PPE is lead aprons, thyroid shields and goggles. The monitoring devices like TLDs and film badges. The safety protocols for these shieldings in hospitals is training for staffs on radiation safety, regular equipment inspection and maintenance, then incident reporting. The shielding verifications are inspect shielding during installation and the periodic radiation surveys. Design example is X-ray rooms is 2 mm lead equivalent in valves, doors and windows. Lead aprons and thyroid shields for staffs. CT scanner is 3 to 4 mm lead and 1 to 2 meters of concrete. Consoled areas is shielding. Emergency response or spill response protocols, evacuation plans and the radiation monitoring is based on the area monitor and personal dosimeters. The regular audits is used for radiation monitoring. Training and education. The initial and annual training for staffs is necessary. The patient education on radiation risks is also informed. Then the quality control. Regular checks on shield integrity and also the equipment calibration. The case study about this is hospital shielding is assessment of shielding needs for a new hospital wings. Implementation and verification. Challenges and limitations in this is cost and space constraints. The radiation shielding should have a specific space for this. And this emerging technologies is EG proton therapy. Future directions for this is advanced materials, example lead composites, then AI in radiation safety planning. The final conclusion is effective radiation shielding protects staffs, patients and the public. Ongoing education and quality controls are essential. Thank you.